So good afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset, and I would like to welcome you to today's webinar on abdominal aortic aneurysms, stomaching the heart truth, presented in collaboration with Friends Health Connection. This webinar is the conclusion of a 5-part series of virtual education programs on heart health that we offered throughout the month of February, which is American Heart Month. The aorta is the main artery in our body, and its function is to carry blood away from the heart. Weakened, bulging sections of this critical vessel are called aneurysms, and they can potentially be life-threatening. During today's webinar, we will learn more about abdominal aortic aneurysms, also called AAA, their relationship to the heart, risk factors, symptoms, diagnostic and treatment options, as well as prevention strategies. We are pleased to be joined by Dr. Brian Wernick, a vascular surgeon at Robert Wood Johnson University Hospital, Somerset. We will begin our webinar with about 30 minutes of a moderated discussion, and then we will open it up to questions from our audience. So once again, thank you for joining us, Doctor. We really do appreciate it. I understand Dr. Patel was caught in a case. So if you wouldn't mind, if we could just start off by having you tell the audience a little bit about yourself.
Sure. Thank you so much for having me. My name's Brian Wernick. I'm a vascular surgeon with the group Advanced Vascular Associates. And we just recently are joining the Robert Wood Johnson Somerset family. And so thank you for bringing us in. And so I'm actually a Pennsylvania native, born and bred there. And I went to Temple Medical School, and then I did my residency at St. Luke's Hospital in Bethlehem, Pennsylvania. And then I just got back from Chicago. I was doing my fellowship at Northwestern out in Chicago, and now I'm happy to be here in New Jersey.
Well, we're glad to have you, and thank you once again for joining us.
Of course.
So let's begin with an overview of the aorta, what it does and why is it important. Could you please give that overview to our audience?
Sure. So vascular surgeons are kind of like plumbers. We try to make sure the blood is flowing nice and easily throughout the body. The aorta is the main blood vessel that carries blood out of the heart and takes it all over the place. It's the main pipeline that runs down the middle of the body. It comes out of the heart, runs down the chest, and then in the pelvis, it splits into a left and a right, and then that takes it down to the right and left leg. The aorta also gives off critical branches to our intestines and our gut, as well as the arteries to the kidneys.
Thank you so much. That was a great explanation. So now then, can you explain what is an abdominal aortic aneurysm? Saying that 3 times fast is very tricky.
Of course. I feel like I do this on a daily basis with my parents who are still trying to figure out what the aorta is. So yeah, an aneurysm is when the aorta becomes too big for its own good. It's when the wall of the aorta weakens over time and the aorta blows up like a balloon and it gets really large. The concern when that happens is that it could rupture. And if the aorta ruptures, then that's really a bad news bears kind of a situation. And we can talk more about that. But the bottom line with the aneurysm is that it's an enlargement. It's when the aorta enlarges over time. Aneurysms can actually occur all over the body, can occur in different arteries, but the aorta is the most critical.
So then what actually causes it?
What happens over time is that the wall of the aorta weakens, and this can be due to any number of factors. The most common is smoking. Smoking can cause the muscle in the wall of the aorta to degrade over time. The aorta is naturally a very elastic part of the body because with every heartbeat, it expands and relaxes. But when you lose that elasticity, then the aorta tends to blow up like a balloon, and smoking is one of the most common reasons that can happen. Other causes involve people with a family history. If people in the family are just prone to getting aneurysms, that can be one possibility. Some people have genetic disorders where their connective tissue is weak, and so the aorta can become aneurysmal in those instances as well.
So, so then who's most at risk? Would you say it's smokers or male, female?
Absolutely. Male smokers, elderly male smokers are most at risk for sure. Females can also get it, but not quite as often as males. Males, it's about 2 to 1 male to female ratio. And that's the most common. Otherwise, people with family history, that sort of thing. But male smokers is the most common.
Okay, wow. All right, so then what are the symptoms of AAA?
Yeah, so aneurysms are actually asymptomatic. Most people have no idea they have an aneurysm. They can go throughout life, never know it, and then all of a sudden one day it can rupture. So sorry to scare people, but that is the truth. However, in some people can have back pain, which is obviously the cause. A lot of things can cause back pain. Most of the times it's just musculoskeletal. But if you have that smoking history, if you are a male, sometimes a nagging back pain that could be an aneurysm. Other causes, other symptoms, basically rupture. People who present with a rupture is basically a lot of that. What happens is a great deal of bleeding, and so if people have internal bleeding, they could potentially pass out or become very lightheaded or dizzy, or abdominal pain as well.
Okay. So when should somebody see a physician for this?
So pretty much any male smoker over the age of 65 should have a one-time screening, either ultrasound or CAT scan, to see if there is any aneurysm in the body, in the aorta. Otherwise, you generally those are the screening guidelines. If you have anyone in your family who's had an aneurysm, that would also be a reason to get yourself screened. But generally, that's the most common, is if you are a smoker, if you are over 65. Now, if you've had abdominal pain that's new, maybe for a week or two, that's not going away, back pain, same deal, you should get that checked out by your physician as well.
Okay. And, because, unless you're having some of those signs that you mentioned, would a routine physical exam pick anything up?
It's a good question. Yeah. So if you have a large aneurysm and you're a skinny person, or you have a small to medium build, your physician, if they're doing an abdominal exam, a lot of times they will pick it up, but not always. Sometimes if it's not big enough, or if you're a larger person in general, it's a little harder to feel. The aorta sits in the back of the body. It's like kind of sits right on her spine. And so it's pretty deep. You have to feel, you have to press down pretty deeply to really feel it. So only if it's a really large aneurysm, or in a very skinny person, or some combination of that, can it be detected on physical exam. Otherwise, you need an ultrasound or a CAT scan to find it.
So you mentioned about ultrasound and CAT scans. Are they the only screenings, or what other screenings are available for abdominal aortic aneurysms, and who should be screened?
Yeah, so those are really the most common. Sometimes people can get an MRI, you can get other imaging, but a lot of times it would be detected for some other reason. Like if you're having abdominal pain and your gastroenterologist wants to get an MRI, they might see that you happen to have an aneurysm. Incidentally, they just happen to find it. But the screening is an ultrasound or CAT scan if we're specifically looking for an aneurysm. And who should get it? It's males over the age of 65 who have any history of smoking.
Okay. So now let's say, unfortunately one is detected. So what are the treatment options?
It's a good question. So aneurysms historically, going way back, have been treated with open surgery. It's typically a pretty major surgery. It's a large incision in the belly or on your side, and it's up to a week to 2 weeks in the hospital. However, over the last 2 decades, really 3 decades, we've been able to fix these endovascularly. In other words, there's minimally invasive techniques where we are able to put a stent graft into the artery and basically exclude the aneurysm by preventing the flow into the aneurysm, and we force the flow through the stent graft.
Oh, wow. Very interesting. So now, are there any potential complications from abdominal aortic aneurysms?
Yeah, so the main complication is rupture. And that's the scariest thing. And really ruptures, if an aneurysm ruptures, a lot of people, most people don't survive. However, that's not to say everyone, but that's the main complication of an aneurysm. Sometimes you can actually get an infection in the aorta when you have an aneurysm, but that's very rare. But it does happen from time to time.
Okay, so let's talk a little bit about prevention. So, and I think I know one of the answers, but what can you do to reduce your risks for developing an abdominal aortic aneurysm?
Well, I wouldn't be doing my job as a vascular surgeon if I wasn't preaching to stop smoking.
I knew you were going to say that one.
So that's really it. Yeah, there's some medicines. Actually, interestingly, diabetics who often have to take metformin are at a decreased risk of developing an aneurysm. But basically, it's to stop smoking.
Okay, very good. So hopefully all of our smokers will go ahead and try to, kick that habit. So now, I guess, what are some overall general, tips you can offer on how to promote good heart health and vascular health?
Yeah, so I think for heart health and vascular health, it's so important to exercise. And I'm not talking about going to the gym and running 10 miles. I'm talking about walking. Just going outside and taking a 20-minute walk, 30-minute walk, it can really help quite a bit. And it's just the idea of getting the blood flowing, especially people with other vascular problems. It helps to reduce inflammation, and inflammation is also a cause of vascular disease, and it encourages good heart health as well.
Okay. Well, and I know you're relatively new. Your group is relatively new, but can you give the audience a little bit of an overview of the vascular services that we offer here at Robert Wood Johnson University Hospital, Somerset?
Sure. So we're very excited to start, and the main things that we offer are if you have peripheral vascular disease, if you have blockages in the arteries in your legs, we will be able to treat those issues. We also deal with dialysis patients. If you have a fistula or need a fistula, we would be able to take care of you. And we do treat abdominal aortic aneurysms as well at Somerset.
Great. Well, thank you for that. Now, we hear all the time, many people are putting off their regular medical checkups and screenings because of concerns with COVID-19. And I know many hospitals, including Robert Wood Johnson University Hospital, Somerset, have taken precautions. So what precautions are, we, Robert Wood Johnson Somerset, taking during the COVID-19 pandemic? And why is it important that people do not delay in seeking care?
Yeah, it's a great question. So in addition to encouraging all of the staff to get vaccinated, everyone has to wear a mask, no question, inside. And we do everything possible to maintain social distancing. And really at this point, mask wearing, social distancing, getting vaccinated, the numbers are coming down, and you know, it works. You know, that's the bottom line. Those things work, and we take that very seriously at Somerset. And so we're doing all those kinds of things. Everyone's getting their temperature checked when they walk into the building. Everyone gets screened for COVID contacts. So you know, we're really doing everything we can to try to bring down those numbers.
Yeah. And everybody's masked, right? We all have to wear a
Yep.
mask. Although when we're in our own little offices, ladies and gentlemen, if you're not around anybody,
Yeah.
take these off. But so yeah, and it's, you know, and again, these are the practices that we continually encourage folks, right? Wear your
Yeah.
mask, watch your space, wash your hands regularly, and when you're sick, stay
Right.
home, to really curtail this pandemic. So thank you for sharing all about the precautions and about abdominal aortic aneurysms. So what I would like to do now is just open it up, open the webinar up to questions from our audience. If any member of our audience does have a question for Dr. Wernick, please put it in the question and answer section of our webinar. And I will then ask our doctor. So we do have a few already posted. So the first one is, does hypertension make you more at risk for an aneurysm?
It's a great question. So yeah, you know, people with high blood pressure can be at a higher, not necessarily, it's a slightly higher risk of developing an aneurysm. It's not very significant. But if we know you have an aneurysm and you also have high blood pressure, it's very important to keep your blood pressure controlled. So it's slightly higher, but not very much. And like I said, if you know you have an aneurysm, that makes blood pressure control that much more important, because if your blood pressure gets too high, that could actually lead to a rupture.
So do your other numbers have any impact or play a role in that? So cholesterol, you know, anything like that? No? Ejection fraction? No, not really.
Not necessarily.
Okay.
Not necessarily.
So our next question is regarding dissecting aortic aneurysm. So this was a condition that John Ritter had. So can you maybe speak to that, tell our audience a little bit about it, and, you know, again, how it differs from abdominal, you know, what's the difference between AAA and the DAA?
Sure. Yeah, great question. So an aortic dissection is what, and this is actually called, this is directly related to high blood pressure. But what happens is you develop a tear in the inner lining of the aorta, and you get blood flow into the wall of the aorta, which causes this dissection. It dissects the wall of the aorta. This causes severe pain. Patients who have a dissection know they have a dissection. It's very painful. They often come in with back pain that can radiate around to their chest. People will also often have very high blood pressure. They are similar in that some people are predisposed to aortic dissections. The same people who develop aneurysms can develop dissections as well, including smokers. Yeah, so that's really the main thing. It's most often in the chest, though. When we talk about abdominal aortic aneurysms, that's in the belly. But when we talk about aortic dissections, that typically starts in the chest, and then it can spread down to the belly. Dissections over time, if they go untreated or undiagnosed, they can develop into an aneurysm. So then you can have that wall of the aorta, since there's a tear in it, that wall can weaken, and you can develop an aneurysm after the fact, later down the road.
So how common is one versus the other? How common is the DAA, dissecting, versus the abdominal?
Right. So the abdominal aortic aneurysms are more common than aortic dissections, but not by much. That's about 40,000 or so abdominal aortic aneurysms are fixed a year, and maybe 20 to 30,000 aortic dissections a year. So it's a little bit more aneurysms, but not by much.
Okay, well, very good. So now our next question is, can arteriosclerosis of the abdominal aorta lead to an aneurysm?
It's a good question. So oftentimes, atherosclerosis of the aorta and aortic aneurysms are are different. So if you have atherosclerosis, you typically don't have an aneurysm. And if you have an aneurysm, you typically don't have atherosclerosis. But like all things in medicine, there are exceptions. And some people will have a severely diseased atherosclerotic aorta in one part of the aorta, and a different part of the aorta can become aneurysmal. And turn into an aneurysm. So typically they're two different things, but it can occur in the same person, even the same aorta.
So, and I don't want to make any assumptions here, but can you maybe explain for our audience the difference, like what happens with an arteriosclerotic aorta versus, exactly, like, are the arteries closing, are they tightening up,
Sure.
versus a blockage building up in terms of an aneurysm, that type of, explanation?
Sure. So atherosclerosis of the aorta, typically what happens is the aorta gets narrow over time, and you have less blood flow going through the aorta. And sometimes it can even lead to a complete blockage of the aorta. When you develop an aneurysm, it's almost like the opposite problem, where the aorta gets too big, and blood flow through the aorta is not the issue. Why this happens in some people and not the other, I don't really have a good answer for you on that. It's just the way the aorta responds to injury, and because all of these conditions in the blood vessel, whenever blood vessels are diseased, it all starts with inflammation. When there's an injury to the blood vessel and the body tries to repair that injury, and it can do so by either trying to basically form clot, just like if we cut ourselves, we try to stop the bleeding, so we have platelets clumped together, and then that can lead to other cells that get in there, and eventually in people with atherosclerosis, that can cause a blockage in the artery. On the other hand, in terms of aneurysms, you can get a weakening of the wall of the aorta, and that can lead to an aneurysm. So it just depends on the person, I guess.
Okay. Well, thank you for that explanation. So our next question is kind of a situational question. So this individual had surgery for AAA in June. Last February through March, this individual's large toe on the left foot turned black. As time went on, all of their toes turned black. When then they would go back to normal color. But since the doctor was closed, that person decided to wait. The doctor later opened, and she was the first person in and was referred to a vascular surgeon. The vascular surgeon called it shaggy aorta because tiny pieces came off, I guess, the clot.
Mm-hmm.
So the concern is this something that could happen again? And I guess meaning the, I don't know if it was referencing the toes turning or the tiny pieces of the clot coming off again. Right. So I'll let you kind of answer that.
Okay. A great question, and I hope you're feeling better. That's tough to go through all that and then have that happen to your feet. So I hope you're feeling better. I hope you're back on your feet. So this term shaggy aorta is what happens is you get what we call thrombus or clot in the wall, within the wall of the aorta. And that can happen as the aorta enlarges over time. It kind of has to do with if you think about how the river flows, it's really fast down the middle, but on the edges of the river, it's really slow. So that blood flow kind of slows down along the edges of the aorta, and you can form clot there along those edges. And when that clot forms, it can break off, and unfortunately, in your case, it went down to the foot. Can that happen again? The short answer is yes, it could potentially happen again. Now, it depends on where exactly where in the aorta it's shaggy. There is treatment for that. It does involve surgery. But a lot of times we would try to put in a stent graft, do that minimally invasive procedure, but it just depends on where in the aorta it is. When it occurs at the part of the aorta in your belly where there's a lot of important blood vessels coming off, it's kind of challenging to put a graft there, because then you block off the flow to those really important blood vessels. So one of the things that people recommend is putting on a blood thinner, and that can help to decrease the risk of those clots breaking off. Wow.
I never knew there was something called shaggy aorta. So I'm even learning today. Any more questions for our good doctor? So while we're seeing if there's any more questions, let me ask you this. What is the one thing that you could recommend to our audience? What is the one takeaway from today in regards to AAA you would like them to leave with?
If you're over 65 and if you've ever smoked, get yourself screened. Okay. Make sure because you never know if you have it. 9 times out of 10, you don't have back pain, you don't have belly pain, but it could be there. And a lot of times a doctor who you're seeing every year, it's sometimes hard to pick up. So get yourself an ultrasound, get yourself a CAT scan, get yourself checked out.
Okay, so they first go through their primary and request
Correct.
Screening. The primary then writes the prescription, and they go have that done.
Correct.
Okay. Another quick question. I think this is a point of clarification. Same incidence in males and females. I think they're asking, is it like the same number of cases you're seeing, or is it different?
Aneurysms occur more frequently in males compared to females. It's about a 2-to-1 ratio, males to females. Mm-hmm. So, yeah.
Wow. All right, guys.
Yeah, exactly.
You got to follow up, right? Or ladies, you got to help your men follow up with their physician.
Right.
Sounds good. Any other questions? Okay, well, if not, then I'm going to give everybody some time back. And, thank you so much, Dr. Wernick, for the great information.
Thank you. This is great.
With us today.
I really appreciate you having me on.
Yeah, we really appreciate it. I know how busy your whole group is, and taking care of our community. Oh, let me just see. Do we have one more? Oh, nope, just a thank you. So,
okay.
Having said that, then this is going to conclude today's webinar. Please remember that the opinions expressed here by our medical expert are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 1-888-724-7123. For more information about Robert Wood Johnson University Hospital Somerset's Heart and Vascular Services, please visit our website at www.rwjbh.org/Somerset. Once again, on behalf of Robert Wood Johnson University Hospital Somerset, thank you for joining us this afternoon, and be well. Have a great day, everyone.